One question I get asked a lot is how do you clean a pessary? So let's split it into two different categories. First of all, cleaning a pessary for your own personal use at home, and then there's cleaning a pessary in a clinical environment. So for your own personal use, as you're not sharing this pessary with anyone, I hope you're not, we'll have a look at the most trickiest ones, let's say, to clean, and that would be the cube, the shaatz, the gellhorn. So everything else, such as the plain ring or even the ring with the membrane, they're pretty straightforward. But where you've got these kind of pessaries, they're space-filling pessaries, we've got these little holes here where bacteria can collect and grow. So the first thing I must insist, or I do insist, is that you never ever use oil lubricants or oil, coconut oil, vegetable oil, whatever it is. Do not use oil on any silicone or plastic pessaries. The reason being is that, first of all, over time, oil will start to degrade the quality of the silicone. So I've seen people that have used coconut oil and then you've got a little bit of chaffing here on the cube where it takes away the luster. And what happens after that is that you've got tiny little bits of silicone which are rough edges. Now, the last thing you need to be doing is to put a rough edge inside of the vagina. So that's the reason why. Water-based lubricants only. The other thing as well is that the oil-based, no matter how much you wash the pessaries, oil, some residue of oil will stick. And if you've got that residue sticking, even the minutest place, it is a breeding ground for bacteria. So now you know the reason why. Water-based only lubricant. So number one, you can wash off water-based lubricant very, very easily. So let's have a look at these and how you're going to wash it. So you're at home, so you can be in your bathroom, you can wash it under warm running water. You can use non-perfumed soap. There's also a soap, a vaginal soap called lactacid, so you could use that as well. Anything that's gentle. Make sure always after you've washed your pessary with soap that you rinse it and take all the soap residue away. What if you happen to be outside in a public toilet? So take about, if you are sort of needing to remove the pessary for whatever reason. So there are some people that need to remove pessaries such as the tea pessary or even the cubes when they need a bowel movement, because a lot of people find it difficult. You can always leave the pessary in during a bowel movement, but again, it depends on your pelvic floor. So if you need to remove the pessary in a public toilet, always have a bottle of water with you and then just rinse the pessary off before reinserting it. So as you're at home, let's say, and I've got a bowl of water here, so this is my sink, and we're going to wash the pessary as normal. So put it in and then I'll wash it, and then I want to clean these little holes on the inside. So the best way I found is to use either one or a couple of cocktail sticks, and you just gently put the cocktail stick in each hole. And certainly with the gellhorn, because then the cocktail stick then will reach all the way through. And then what you can do is take a clean, this is a man's handkerchief, but a clean cotton. So don't use anything that will have fibres that come off, like your face cloth towels or a bath towel, for instance, or kitchen roll. So we don't use any of that on pessaries because Silicone is an absolute magnet for dust. So we use cotton because no fibres will break off with the cotton. And then the same thing again. So you could dip your cotton in, and this is especially useful if, let's say, you've been menstruating and you've got little bits of membrane, debris, whatever, stuck in the holes. So then the same thing, I take my cocktail stick and I'll just pop it into my cotton handkerchief, and then I'll gently just take the cotton and I'll just poke it through the holes there, like that. Okay, and so that's the way that you clean your pessaries. And then once I've gone with my cocktail stick and I know that all the holes, there's absolutely nothing there anywhere, then what I'll do is I will take clean water and I'll just pop it in the clean water and then shake it dry. So you shake it dry, and again, you never ever use a towel to wipe the pessary dry. It'll dry in seconds anyway when you air dry it. And now you can put your water-based lubricant on and pop the pessary back into the vagina. Or if you're putting it into a receptacle that you don't need it, then you just shake it dry and pop it into the receptacle. One thing, if you are using a plastic receptacle, just make sure that it's not closed so tight that there's no air breathing through it. Because again, if you're keeping your pessary in the bathroom and the bathroom is humid, if you've got this pessary in a closed plastic container, then the container can start to sweat, and then you can end up then with bacterial growth on the inside of the container. So my advice to you, if you are using a container to clean your pessary, is every time you clean your pessary, wash the container very well at the same time. So when we're just being absolutely you can never be over precautious. And so that's how we would do it at home. And if you're a clinician watching, that's how you would teach your patient how to do it at home. So what if, boiling, yes. So you can boil your pessary. So again, we're at home, so no more than 3 minutes. So just a normal pan of plain water. There's no need to put any salt or vinegar, or I've heard all sorts of things going on. Just plain water. Pop your pessary into the plain water, boil it for 2 to 3 minutes and take it out. Allow the pessary to cool down, especially if you are using a pessary with a metal insert. So leave it cool completely down before reinserting it into the vagina. Right, let's go on to clinic. So we're in our clinic, we've got the fitting kits that we use on patients. And at the end of the day, you want to, sterilize all of these pessaries that you have. So the first thing you want to do, I use a product called Enzymed. And Enzymed, this is a pre-cleaner. So what this will do, it's an enzyme that you just literally spray onto your pessary, and you leave that on for about 5 minutes. You can leave it on overnight if you want to, but 5 minutes, half an hour, leave that on, and then that will take away all of the biofilm. So once you've got rid of the biofilm, so now we don't have any what I like to call tents, because a biofilm will kind of protect bacteria, and it's a tent that allows the bacteria to multiply and multiply. So let's get rid of all the biofilm, and then we're going to wash it. So biofilm, wash it the same way as you did with the patients at home. Taking your little stick, making sure that all of those holes are absolutely clear of any debris. And so you're swilling it, and then you can boil it. So if you've got a facility that you're able to boil the pessaries, just get a big pan of plain water, throw them all in the plain water and boil them up I'd say about 15 to 20 minutes, and then throw the water away. Leave the pessaries on a plain cotton surface, or if you've got any of the stainless steel trays, then make sure that those trays are clean, obviously, and then just have them that they're air dried, and then they'll be ready to use for your next patient. If you have any questions, please send them to me at, where is it? pelvicangeleducation@gmail.com. And I think that's it. So I hope this has been helpful, and I shall see you as and when.